People ask a lot about rhinoplasty and its recovery. What we tell patients, the surgery itself takes 2 hours typically, sometimes a little longer if it's a revision or particularly complex, or if additional things are being done concurrently. You leave the same day. There's a splint, a metal splint that's on the bridge of your nose. There's typically some blue stitches at the base of the nose. Everything else is inside with some dissolving stitches. There's some Doyle splints, they're called, these silicone splints holding the septum straight that have a channel with them that you're able to keep clean and flushed out during this initial recovery period. We want to leave the splint and all the tape on and all the splints inside the nose until we see you back, typically about a week later. You go home typically about 45 minutes after being in our recovery room. At home, the first night or two, sometimes there can be drainage or drippage from the nostrils that will want you to keep nasal sprays used. We prefer to let the bottle do the majority of the spray, so we don't want you to sniff in hard yourself through, but we want you to push squeeze the bottle, or have your family member or whoever is with you squeeze the bottle to let the bottle do the work to get the spray in. We want you to keep some bacitracin or other ointments along the nostrils and areas of incision. The other important thing for these first 2 to 3 days is ice in and around the eyes. That's typically where some of the bruising will occur. We like to have green tea bags that have previously been steeped and then placed in the freezer, because those underneath the eyes works really well for bruising and swelling. There's some different creams and ointments that we also can recommend, something called Trameal ointment, as well as arnica cream or gel that can help with bruising and swelling, and just general ice packs in and around the eyes too will be very helpful. We just don't want moisture to get or wick under the tape and allow the splint to come off at all. You can wear glasses during this first week post-op care, because the splint itself is protecting where the nose, and glasses can go on top of that. But once we see you back, which will be 1 week later, a week to 8 or 9 days later, we'll take the splint off, we'll take the initial stitches out, take the Doyle splints next to the septum off. We won't want you to wear glasses anymore for the next 5 weeks. Because we don't want pressure on the bridge of the nose. If you need to wear glasses for one reason or another, there's a headband that we can show you that holds glasses out and away from your nose that you can typically do. At that 1 week period, the nose is not its final shape yet, and it's not the final result yet. It's still going to be quite swollen with some amount of edema, and that will keep subsequently coming down over the next weeks. There's things we tend to do to help get that swelling down, some of the creams we talked about, but also we tend to do some taping. I want you to do some taping of your nose at night. We'll show you how to do that. Sometimes we have some nose cones, they're called, placed into the nostrils at night too, that help round out and help the swelling on the inside of the nostrils improve. And we tend to do some jade rolling, using a jade roller along your face and helping some of the lymphatics open up and bring some of the swelling down that way. We tend to see you after that 1 week mark at about 5 weeks after that, which is 6 weeks from the surgery. In some cases, we may want to see you sooner, but typically we'll see you at 1 week and then 6 weeks. At that 6 week mark, about 70 or 80% of the swelling is down for the nose, but it'll start taking the shape of what we're expecting and anticipating, but the remaining 30-20% of the nasal edema will really take a whole year for that to totally come down. And in some cases, there's still 2 to 5 to 8% of swelling after a year that continues to come down more and more. So it's important to be patient and understand that the nose will take shape and take its form over a period of months after rhinoplasty. It's not going to immediately look like it ultimately will or like we want it to, but things like taping, giving it time, the natural course of healing, it's going to start taking that shape over those few months after surgery up until a year and after a year. In some cases, there are also some injections we may do or consider at certain points in time to help some of the swelling come down or to add a little bit of volume in certain areas. But that's quite rare, but sometimes we do those things as well. In terms of the breathing, usually as soon as the splints come off, 1 week after surgery, you'll immediately notice that your breathing is much, much better. Sometimes after a day, though, that can worsen again as the swelling on the inside of the nose comes back again. So it's important to continue nasal sprays for that first month or two. And usually by the 5-6 week mark, your nasal breathing is back to as good as it was at 1 week. Every case is different and specific, but these are good general rules of thumb that we tend to see and use in our practice. Thank you. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.